Thanks for joining us today for the Young Health Professionals Speaker Series. This series is sponsored by the Chicago South Area Health Education Center program of Project Brotherhood. The mission of the Area Health Education Center program is to enhance access to quality health care, particularly primary and preventive care, by improving the supply and distribution of healthcare professionals. Founded in Chicago, Project Brotherhood is a nationally known nonprofit organization with over 25 years of experience providing health services within communities of color. Our work has included clinical and non-clinical research, as well as direct health services. The Center for Disease Control CDC recognized Project Brotherhood as one of the top 9 programs in the country addressing the social determinants of health. Be sure to subscribe and let us know what topics you would like to hear discussed on our show. Enjoy the broadcast.
Captain Tony Vargas is a senior public health analyst for the Office of Intergovernmental and External Affairs, Health Resources, and Service Administration, also as HRSA, Region 5 in Chicago. In his role as senior public health analyst, he develops and formulates short and long-range public health program goals, objectives, and policies for the agency in Region 5. He earned his Bachelor's of Science in Nursing from Capital University and a Master's of Business Administration in Healthcare Management from California Coast University. His previous assignments include long-term care surveyor at the Centers for Medicare and Medicaid Services, project officer for the Bureau of Primary Health Care at HRSA, nurse consultant for the Title X Family Planning Program. Captain Vargas has been deployed 14 times throughout his career to multiple disasters and emergencies in the role of registered nurse, forest health clinician, and case manager. He is committed in his clinical work and role as a senior public health analyst to work toward health equity in reducing the incidence of chronic disease for all citizens. Prior to joining the United States Public Health Service Commission Corps, he was assistant manager for the intensive care unit at Huron Hospital in East Cleveland, Ohio. Thank you for joining us tonight, Captain Vargas.
Oh, pleasure to be here.
Yeah, so my first question is, can you share with us your journey into nursing and what inspired you to pursue this career path?
That's a good question. I had a kind of a long journey. I graduated from high school in Cleveland, Ohio. Then I went out to college. I didn't know what I was going to study. I was going to study accounting, maybe be a business major. But eventually I got sidetracked, dropped out of college, learned a trade. I was a machinist. I was a CNC machinist. If the audience knows what that is, a computer numerical control machinist. So we would program computers to run machinery and on a factory floor, which is kind of high tech. So I did that for about 4 years. And I got tired of doing that, and I didn't know what else to do. One day, the owner of the company came in and said, my niece that's an OPN makes the same amount of money as you do. And I thought that rang a bell in my mind. I said, you know what? Let me start thinking about a different career, because I didn't see much of a future doing what I was doing at the particular company that I was employed with. So I started to have my mind churn, and I said, let me see what the medical field has to offer. I looked into physical therapy and I looked into nursing, and I said, you know what, I can be a registered nurse. So I decided to take some prerequisites at the local community college in the Cleveland area, and I applied to nursing school, and I got into nursing school. So I became a nurse and graduated from nursing school in 1998 from a hospital program, the Huron Hospital School of Nursing program, which is a diploma program. And then I went back while I was working as a registered nurse. I got in the intensive care unit at Huron Hospital. And while I was working there, I went back and got my bachelor's degree. And let me see. And while I got my bachelor's degree, it was a very exciting time, but it also turned some of the wheels in my mind to saying that, I have my bachelor's degree now, I can be an officer in the military. So I looked into the various branches of the military. I looked into being an Army nurse. I looked into being a Navy nurse. And I was going to look into the Air Force, but I had seen a pamphlet for the United States Public Health Service. And I said, this sounds kind of interesting. Let me see what this is all about. So after speaking with an individual from the United States Public Health Service, I liked what they had to say. So I ended up joining the United States Public Health Service because, I just said, I could be a hospital nurse for the rest of my career, or I can just branch out and do different things. So I decided to do different things with my nursing degree.
Nice. That sounds great. Can you tell me, did you have anyone in your family that was in the medical field? when you were considering applying for a nursing degree? Like, did you have anyone to like give you any tips?
Oh no, none at all, none at all. I was kind of reading books, manuals, books, nursing publications, career publications, and they said it was always a good career field for men to get into. For some reason, they kind of implied that men had an upper advantage, but I don't think that's true. But they kind of implied that in many conversations I've had. But no, I didn't have any relatives that were in the medical field at all.
Okay, yeah, that's what sometimes like some people do. But yeah, so interesting though about the male nurse part, or like men in the competitive in the nursing field. Can you talk about that as well? Because I know that's kind of like male nurses. It's a might be a different experience than if you were a female nurse.
Yeah, I think it's a very stereotypical that nurses are female. I know I had that said to me a few times from my younger folks. They would say, "Oh, I thought this was years ago. I've been a nurse for over 20 years." But they would say, "Oh, nursing. I thought that was a female profession. Why are you getting into that? But there are men getting into nursing. There are when I graduated from nursing school, there were approximately I think 60 graduates the day and evening programs, and there were about 8 to 10 net males, and the nursing instructors were very excited that there were more males getting involved in nursing.
Yeah,
But males are, branching out into non-traditional roles, non-traditional career fields. So I think nursing is a good opportunity, and males are getting involved, and there's a wide plethora of job opportunities in the nursing field.
yeah. Did you talk about that like over the years? Did you see the I guess the not the population, but like the number of male nurses increase in your jobs or anywhere else you worked?
Yes, as I began working, I did notice, on the nursing floor, there were some nights that we were all males working on the nursing floor, and that provided a different vibe to the nursing unit when I was working. But yes, more males are getting involved, even with the United States Public Health Service. There's a large percentage of males that are nurses, nurse practitioners, and nurses with advanced degrees. I believe the Army has a large percentage of male nurses, that get involved in the Army and their nurse corps. So there are more males getting involved in nursing.
That's pretty awesome because yeah, 'cause I don't see too many of them either. But I do not necessarily get excited, but I'm definitely like, yeah, there's it's a little bit different than what you see. Did you encounter any pushback or any like stereotypes at all? Like being a male nurse in a field where it's almost private, it's mostly women when you see when you're working.
Sometimes you get a little pushback in terms of I would go when I was working on the floor. I don't work on the hospital floor full time now, but when I was working on the hospital floor, I would walk into a patient's room and they would all automatically assume that I was the physician going to be taking care of them, and I would say, "No,
Mm,
I'm the nurse that's going to be taking care of you." So that was shocking to some of the people. They would say, "Oh, you seem like you're the doctor," and I'm no, I'm a registered nurse. I'm going to be your nurse for the night or the day, and I would get that stereotype. And so, and I bet some women get that stereotype also. If they become a physician, they might, get referred to as a nurse. Oh, I thought you were the nurse. I didn't think you were a doctor. But so, yeah, there are those stereotypes and that situation going on still.
see, do you in those situations, when you're caring for patients, did you approach like patient care and communication differently compared to maybe your female counterparts?
Well, I think I would always have to announce that I'm the nurse. I'm going to be your nurse. I wouldn't automatically assume that they knew who I was. So I would have to announce that, I'm going to be your nurse taking care of you during your shift. And, when I introduce myself to other folks, even now in my role, I just say, I'm a nurse by background. I'm not a physician. I'm not this other role. I don't have these other credentials, but I have my RN credentials. So that's how I would introduce myself. That way they clearly know who I am and what my role is there at the time.
Yeah. Um, do you feel that there are specific areas in healthcare where male nurses can make significant contributions?
And healthcare in general, yes, this all over the healthcare. Nursing, physical therapy, not just the physician role, but physical therapy, psychology. I think a much needed. There's a lack of mental health therapists currently, lack of psychologists, lack of social workers that may. I'm encountering more and more male social workers when that was traditionally a female role and profession, but there are more males getting involved with social work. So that's always needed, especially in mental health these days. I think mental health therapists, male mental health therapists, either psychologists, psychiatrists, are needed need badly.
Yeah. Could you tell me more about that? Like thinking about like nurses in psychology. I didn't really think that was
Yeah,
there was an
there
intersection
are.
there.
Yeah, I think many nurses get involved in the mental health arena, and they're also you could get a master's degree or doctorate and become a nurse practitioner in terms of like a psychiatric health nurse practitioner. So that's like a specialty that you can pursue in the nursing field. So that's something to pursue. There's much needed on mental health wards and mental health counseling that's needed that nurses can provide with advanced degrees. Even nurses with the registered nursing degrees, we do take psychology courses or mental health courses in our curriculum. So that'll be very helpful and useful.
That's a lot. So can you discuss any challenges that you had, in your experience as a male nurse? I think just in general, like maybe even through school and your job at working in the healthcare field.
I think the challenge is sometimes doctors will treat you a little bit differently than a female nurse. Sometimes they're nicer if you're a male. They have, that's why a lot of females enjoy having males on the floor. Maybe they don't get bullied as much if it was all female staff. Sometimes maybe a 6 foot nurse. I'm not very tall. I'm only 5'6", but there are nurses that are like 6 foot or 6'1".
Right.
They tend to not get bullied or pushed around by the doctors if they're big and strong in stature. So, but most of my experiences have been very positive with working with the various departments at the hospital, and even now, most of my experiences have been very positive. So, not too many negative experiences.
Nice. Okay. Yeah, that's what I was curious about too, just being a nurse. Because I have friends who are male nurses and they don't they kind of they they I guess they really also haven't noticed a whole bunch of issues when they're working. But I always thought it was really interesting too, just knowing many male nurses. Um, so about your DHS background or DHHS background, I'm sorry. Um, can you describe your role as a nurse consultant within the DHHS and how it contributes to the department's overall mission objectives?
Yeah, I'll describe my career, I guess, journey, as if you want to call it. I started with the Centers for Medicare and Medicaid Services, and my first job there was a long-term care surveyor, which is also another word for nursing home inspector. So basically, I was a nursing home inspector for about 5 to 6 years, and we would travel in teams, sometimes solo, but sometimes in teams throughout the Midwest. So the Chicago office covers the states of Illinois, Michigan, Ohio, Indiana, Minnesota, and Wisconsin. So we would travel within those 6 states, and we would inspect nursing homes throughout the state. So it was very different from what I was doing previously. I was a hospital nurse working in an intensive care unit, basically a trauma unit. I saw a lot of surgeries, car crashes, gunshots, stabbings, and that scenario. But then when I came to the government to expand my horizons and see what else I can do with my nursing degree, I became a nursing home inspector, and that's when I joined the public health service and started wearing the uniform. But yeah, that was my first job as a nursing home inspector. That was eye opener. We had a big manual and violations or conditions of participation, they would call it, and we would have to rate the nursing home on various criteria and give them a tag, they call it, or give them a violation based on what we saw and the severity of the violation. So that was always interesting, and we did get to travel throughout the Midwest, so that was always interesting, and I got to see different parts of the country and the Midwest that I would probably never seen before. After that, I started working for the Health Resources and Services Administration, where I'm working now, but in a different capacity. I became essentially a project officer, but I was managing grants for community health centers in central and southern Ohio. And a community health center is a clinic or entity that gets funding from the government, and you can get your primary care there. They do offer all types of services, sometimes vision, dental, mental health, and also prenatal care in many instances. But these organizations, these clinics receive funding from the federal government, and my job was to make sure that paperwork was in order, make sure they turned in the paperwork in order, make sure that they received their funding, and also to do site visits. I would go there with 3 consultants: a financial consultant, a clinical consultant, and an individual that was very keen on the rules and regulations of a community health center. So we would go there as a team and go there on site and see their performance and look at their policies and review their accomplishments for the previous year and see if they're on par with the government regulations. So we would do that at least once every 2 to 3 years with each clinic that I had under my purview, as you would say. So that was my job there. And then I went to the Title X program, which is the family planning program. And that was similar to the role I had as a project officer for community health centers. But instead of a community health centers, I was overseeing grants for family planning clinics, such as Planned Parenthood or other organizations that would provide health education regarding sex education, birth control. They would dispense birth control and things of that nature. And they would also provide primary care to individuals. But it's basically geared towards female patients and female clients, but they did offer services to male patients also in terms of health education, STD checks, things like that, STD exams. So that was very interesting. And then I came back to HRSA, where I am now, Health Resources and Services Administration. And now my role is like more of a liaison role. And I get out into the community, explain what the services that we offer, what funding that HRSA offers, and see if individuals can become more aware of what we offer as an organization.
That's a journey.
Yeah.
That's a really, really long journey. I really want to. That's great. I actually want to go back all the way back when you first mentioned your transition from a hospital to your job after that. How was that kind of transition? Like going from, you said, shooting and stabbing to something more like assessing,
Right.
like houses or homes or something like that. What was
Yes,
that like?
it was you still have your base of medical knowledge, so that comes in handy, but you're essentially expanding your knowledge, on what you've learned in the past. So it's like a ever expanding knowledge base that you have in your mind, because you do have your things you learned in school, things you learned on the job, and then things you learn throughout your career as you go along. So it was a big adjustment, because I was basically doing hands-on in the hospital. And then as a nursing home inspector, I was like watching other people do work and kind of walking around the nursing home with a clipboard, seeing, if I saw anything improper, to discuss with them later on throughout the visit. But it was a big adjustment, because you have to, I guess, wear a different hat, instead of doing a procedure hat, you're doing an inspecting hat. So it's very different. But you do get to use all your medical knowledge still, you do have that in the back of your mind to see, because you kind of know if they're doing things correctly or incorrectly. But you do gain additional knowledge, because I didn't know many of the nursing home regulations and the requirements that they have. And we would inspect everything in the nursing home, the care received, the medical care received, the medication passed. We would also observe the dietary department. So I learned about the kitchen requirements, the food requirements, things like that. Also the administration requirements in terms of nursing home legislation and the state requirements for the state of Illinois or the particular state that they're located in. They have also requirements, and also the federal requirements. So it was a very interesting journey, as opposed to working in the hospital, just providing hands-on care, not really worried about some of the laws and regulations that are required, of the hospital.
Right. How did you feel about that shift? Like, I mean, were you kind of like, oh, do I ever miss the hospital, or?
Oh yeah, definitely. Yeah, you definitely missed the full-time hospital work, but there's opportunities for nurses to do like part-time work, either volunteer or paid. So there's also opportunities to do that throughout the city, city of Chicago or any other city. So there's opportunities that many nurses do that. Though sometimes nurses have 2 jobs, or 2 part-time jobs, or 1 full-time and 1 part-time, and they'll just branch out and use their nursing skills in many different ways.
Sounds very versatile, honestly. Being a nurse, you can do so much.
It can be, yes.
What about traveling around? You said you were did some traveling when it came to using your degree. Any particular places you like the most to work at?
Well, as a part of the public health service, they do deploy us, because we're one of the 7 uniform services. I'm not sure if the people in the audience know that there's 7, and probably actually 8 uniform services. There's Army, Navy, Air Force, Marines, Coast Guard. Everybody knows about those. There's also NOAA, which I think stands for National Oceanographic Atmospheric Administration, and they do with the weather. But they have a little bit over 100 officers there, and then there's the United States Public Health Service. So there's about 6,500 of us, and we're all medical professionals. There's also the Space Force with the Air Force. That's what number 8. But the United States Public Health Service, that's why I'm wearing the uniform, is we work underneath the Surgeon General in essence, but we're all medical professionals, and we're doctors, nurses, physicians, nurses, dentists, physical therapists, pharmacists, IT professionals, social workers, and you can work for a wide range of federal agencies. I didn't realize this going to nursing school, that even the public health service even existed. I just saw a pamphlet about it, so that's how I found out about it. Because there's a running joke that everybody knows about the Marines, the few, the proud, the Marines. We like to joke about the public health service that we're the few, the proud, the unknown, because we're like the unknown service. So being part of the public health service is that you're on call. Sometimes they'll have you on an on-call schedule, like every 5 months, you're on call to be deployed at a disaster, a tornado, a hurricane, or another disaster. So I was deployed, numerous times throughout my career. I was deployed for hurricanes. I was deployed on the border to take care of the children that were coming over the border, to do various tasks for that mission. I was deployed during COVID. Many of us were deployed constantly throughout COVID I was deployed to Yakima, Washington to do swabbing for COVID. I was deployed to backfill nursing homes in Minnesota for COVID. I was also deployed to Florida, Orlando area and Jacksonville area at nursing homes to help them with their situation out. So those are some of the places I've been deployed to, and I've kind of enjoyed all of them because I got to meet individuals from all over the country. I met fellow officers that were deployed with me from all over the country, and get to experience a new city, a new clinic or a new setting, and meet new individuals from all over the country. So that was pretty exciting.
That's wonderful. What did you learn? What were some things you learned from traveling to all those places that you bring back home to your organization?
I think there's I guess you learn about flexibility, because sometimes you go on these missions and you go on these deployments, you have no idea what you're going to be doing. So you have to be flexible, and you have to kind of do what you're told and be ready to change things on a dime. So you kind of learn that aspect. You also kind of develop a sense of self-confidence that you're able to travel alone and get travel orders and fly across the country and be ready to work. So you get that advantage and those skills. So when you get to the opportunity to work with different people, so you have to be flexible and working with individuals that you've never met, and you have to accomplish a mission with those individuals that you're going to be working with for the next 2 to 4 weeks.
Okay, yeah, I was about to ask how long you're out there.
Yeah.
So what was like some of your day-to-day tasks then at the time? Like, was it like?
Yeah, if I was at the clinic in Washington, we were deployed to an Indian Health Service clinic. So basically, our job was there to swab for COVID, for the virus, mostly all day long, either swab and also to run machinery that was there, run the lab work. We had individuals that had lab experience, so they would run the lab work there when we did swab them. Do some intake information. We had a pharmacist there that was assisting the pharmacy department there at the Indian Health Service Clinic. When I was deployed to Minnesota, that was a nursing home environment. So we were like approximately 8 or 9 nurses that were deployed there to help assist during COVID, because some of the facility nurses at the nursing home had to take off because they had caught COVID. So they had to quarantine themselves and be off for 2 to 3 weeks. So they needed staff to work there. So we were the staff that was working there. And that was basically basic nursing skills that we utilized, and we would take care of the patients as a regular nurse would. And then when I was deployed to the border, there was a situation where many of the children were separated from their parents when they came over the border. So we're kind of like acting like caseworkers or social workers, trying to reunite the parents and the children, because the children were sent all over the country to different foster care settings and to different adoption centers. So we had to somehow make phone calls and talk to the parents and see what country they were from and if they had any children in the U.S. and the last time they spoke with them, and try to reunite them over a 2 to 4 week period that we were there. So it just varies. It just varies on what they want us to do. It could be almost anything, a lot of paperwork, administrative things, or even hands-on things. So.
Yeah, that's definitely that runs the gamut where you're like just doing regular healthcare stuff to social work stuff. Nurses are the backbone of everything. I mean, for real. So Nowadays, what are some of the, I think you mentioned, what are some of the key responsibilities that you typically handle in your role?
Currently, it's just organizing events. We might have an event on based on the administrator's priorities. I know the current administration, their priorities are behavioral health, maternal health, and workforce. There's a shortage of workforce workers in many parts of the country, and a lot of it's geared towards mental health. I know a few years ago the big push was to address the opioid epidemic, so they're trying to find mental health workers that can provide counseling and provide addiction services to those individuals that are have substance use disorder. So my job is to kind of address those areas in terms of being having people get aware, make them aware that there's funding available, different types of funding for your clinic, for your institution, and also there's our HRSA Health Resources and Services Administration offers scholarship and loan opportunities. So there's a lot of opportunities for scholarships for physicians, nurses, dentists, social workers, mental health therapists, for scholarship opportunities to help them complete their degree or to finish an advanced degree. There's also loan repayments where if you have outstanding loans, you can earn $25,000 to $50,000 a year, depending on your specialty and depending on how many year of commitment that you want to offer at a particular site. So there's also loan repayments. Many individuals take advantage of this loan repayment opportunity, and they're able to pay back most of their student loans or all of it, depending on how many years they serve at a particular site. So that's kind of like my job, to get the word out about all these opportunities that my agency offers, to have events. I've done homelessness events last year. I've done webinars, especially during COVID, we did many webinars, and we just want to get the word out about what HRSA offers and the various programs and the various funding opportunities that we have and the loan and scholarship opportunities that my agency offers.
Can you talk about some of those too? Because I mean, I think a lot of the audience, or some people in the audience, definitely have student loans if they're health professionals.
Yeah, definitely. If you want to look at the website, but if you probably have to Google Health Resources and Services Administration, HRSA, HRSA, and then add on to it Bureau of Health and Workforce, which is BHW. The website will come up, and there's multiple opportunities for loan and scholarship programs there. It's very detailed there, so you can kind of read over, what if you qualify based on your profession. I know most physicians qualify. Many nurses qualify, especially nurse practitioners, those with advanced degrees. Dentists qualify, and also, sometimes they'll add new categories into those funding opportunities for health professions. They sometimes offer it to veterinarians, also optometrists, mental health providers, social workers, psychologists. So it all depends on who they're trying to fund and what category they're trying to increase the population of.
Can you talk a little bit more about the initiatives that you guys are working on right now to get the word out?
Right now we're going to be having an event on May 23rd at Harold Washington Library. It's still in the planning phases, but it's going to be with the Area Health Education Centers of Illinois, the Chicago AHEC, as it's called, the Area Health Education Center, and also the ones throughout the city, throughout the state, and also the Illinois Department of Commerce and Economic Opportunity, or the Illinois Workforce Board. They're going to be part of it, and also the Chicago School of Psychology, and also one or two other organizations that have got on board the Illinois Workforce Partnership. And basically, that's an opportunity for these various organizations to describe their work in the area of health education, to network and to just bring the public to the library. I think the seating is about 350 individuals can be seated there. So it's a free event. You might have to pay for parking or provide your own transportation, but it's going to be on May 23rd. That's a tentative date, and it's going to be breakout sessions. You'll probably find out a lot about these organizations. They probably be bringing pamphlets and this additional information, but that's just one of the events. So, HRSA will be explaining their programming, their scholarship and loan opportunities. The AHEC will explain their opportunities and the things that they offer. It's going to be geared towards high school and the youth, trying to increase the pipelines for individuals interested in health careers.
Yeah, that sounds amazing. I mean,
Yeah,
I'm excited just thinking about it.
yeah,
I think for me growing up, I was very much into the health careers. For me, I'm more of an epidemiologist by trade, or by trade, by schooling. And so me even I don't know if you guys are talking about public health either, but like I didn't know much about public health growing up. All I knew was doctor, dentist, nurse,
right.
and that was it. So I think even like giving any ounce of information about anything health related and how what that looks like, I think that's a great thing to do. Um,
Definitely.
yeah. So, in your opinion, what are some of the most pressing public health concerns facing our society today, and how is your office addressing these issues?
I think one of the biggest issues right now is health workforce. There's a lack of healthcare workers, especially in rural areas. There's also a lack of faculty, especially nursing faculty. I think a lot of nurses can make, it's more lucrative to work outside of a higher education institution than working for that institution many times. I guess they can make more money outside of that institution than working for that institution. So many community colleges and universities may have trouble recruiting staff. That's a big issue. Also, mental health providers in rural areas. Many times the bigger cities are more appealing to health professionals, and also the bigger cities can provide a better income package and compensation package to those individuals. So that's a big issue. Also, the opioid epidemic is a big issue, and um, we're providing funding for various mental health providers and addiction specialists that can help provide counseling. And we're also providing funding for various clinics, the community health centers, so they can get on board and provide counseling and mental health services to those that are addicted to various substances. So that's some of the ways that my agency is helping out with these various initiatives. And there's
That's
also
wonderful.
there's also the maternal child health initiative. There's my agency provides they have a bureau called the Maternal Child Health Bureau, and it's all focused on mothers and babies and children and toddlers. So they have the home visiting program, and many of the there's quite a few organizations in the Chicago area that participate in the home visiting program, where individuals or health professionals will go on site to a mother's house and help her out with education of her newborn, and how to properly take care of her newborn and her child pre-birth and also after baby's born. So
Out of all of these, I'm curious. These are all very important programs. Is there one that you're like that's really like near and dear to your heart that you're really passionate about?
I like them all, but I guess I joke around with people and I tell them that when I was going to nursing school, I didn't have any financial help. I had to get my uncle Visa to help me out, so I had to use my credit card, and had to use my credit cards and student loans. So I think it's good for individuals, especially future healthcare leaders to or healthcare professionals, to know about the other scholarships and loan programming that's out there. So and I just met a female that was a mental health provider, and she had about, I think, about $75,000 worth of student loans. So she applied to the loan forgiveness program at HRSA, and part of the agreement is that you provide your services at a qualified institution. But a lot of these organizations are in the city, in the suburbs, or in the rural areas. So they're not hard to find. They just have to have a particular, they call it a health professional shortest area score, HPSA score. But if they have a high enough score, you can provide your services there for a 3-year period, and you'll get, I think, during the program she was under was $25,000 a year. So she was able to get each year that she served at this clinic, and plus you're getting a irregular salary for your profession. If you're a physician, you get your regular physician salary. If you're a dentist, you get your dental salary. If you're a nurse, you get a comparable nursing salary. So she was getting her mental health provider salary, and each year she was getting $25,000 of her loans paid off. So in 3 years, she was all her student loans were gone, from her college years. So that's pretty exciting to me, anyways, when you could have and I've met physicians that, worked at clinics for like 6-7 years, and, they've owned like $100,000, $200,000 worth of debt. And they were, over time, they were able to get those loans paid off, completely. So that's pretty exciting.
Yeah, that's amazing. I think I've always loved that because
Yeah.
You provide a service, a needed service to a
Right.
community, and you get that back, get that paid back in return.
Right.
Because I also have friends who are medical, the medical field or doctors, and the amount of money they have in debt really
Yeah,
makes your head spin.
right.
It's a lot. It's a lot. Um, so how do you stay informed about the new developments and best practices in nursing and public health to inform your job as a consultant?
We kind of read, we share articles amongst each other. We get journals, nursing journals, public health journals. The agency is always forwarding articles to everybody to keep abreast on things. And sometimes you have listservs that you're a part of that are well known that you might want to subscribe to. So those help out quite a bit.
Okay. Are they internal listservs only, or are there like maybe listservs that non-HRSA people, like the I guess the lay people, can get
Lay people
into?
can, yeah, lay people can get involved in some of these listservs, especially for information about HRSA services and scholarships and things like that. That you could go to hrsa.gov website and click around there. There's some listservs that you can get on, but there's also publicly available listservs that you can get on for public health information. I know CDC, a lot of the agencies have listservs that you can be a part of. CDC has a listserv. National Institutes of Health has a listserv. So each agency has their own listserv that you can be a part of and get up to date information.
Can you discuss the importance of evidence-based practice in healthcare policymaking, and how do you incorporate that into your work?
I think that's important. It's very important to have evidence-based information. That way, when you share information with the institutions that you're providing services to, that they know it's a valid information. They're aware that this information has been vetted. That's most likely in a peer journal somewhere, and that it's good information. Sometimes when I used to do nursing home inspections, I would share information that was peer reviewed or some sort of a textbook, and it was valid. It was not something that us nurses kind of like made up or something like that. It was something that was valid and it was peer reviewed and it was from a journal, from a textbook. So
Was it always like well received, or was it kind of like even they were still kind of skeptical, like,
um,
I
I,
don't know?
I think once you provided the citation, or you provided the article or provided the textbook information, they kind of took your word for it, because sometimes I guess if you go to a gym, I'm going to use a phrase that may relate to what I'm talking about, but I know when you go to a gym, there's individuals at the gym, they call it bro science. It's not really science, but they call it
Yeah,
bro science.
I understand
Whether
about
they,
yeah.
yeah, so in the healthcare field, sometimes there's science that's passed around that might not be valid. And I'm not sure the term for it is, but but once you have the evidence-based information, you can share that and be confident that this is how it should be, or this is the proper technique or the proper information, that you want to utilize, and this is what you want to go to. So.
Yeah. So next thing is so for people for aspiring nursing consultants who want to be in the government agencies like the DHHS, what advice do you have for them?
Oh, okay. I just advise you to, if you want to get a job with the government, there's also the very handy website called USA Jobs, usajobs.gov, I believe is the email address or the address website. And there's all the jobs for all government agencies are listed there. So that with all the criteria that's required, and I recommend that you apply. If you're interested in the public health service, just go to www.usphs.gov. You can find out more information on the United States Public Health Service. And remember, when you're working for the federal government, you can work either as a civilian or as a public health service officer. So, you might go into an office, only see one or two of us wearing a uniform, or you might see, many of us wearing a uniform. So it all depends. There is a different pay structure and also a different benefit structure with the public health service and with the civilian counterparts. You might be doing the same job, but there's different pay structure and different requirements. We have our pay structure is similar to the military. We have a rank structure. We use the TRICARE military insurance. We have a 20-year retirement plan, whereas the civilian section, they have the federal employee retirement system. They have different vacation time and different benefits. So it's kind of different. So in the civilian sector does not get deployed, whereas the United States Public Health Service, as part of our job requirements to be deployable. and things of that nature. So yeah, I recommend to check out both sides. You might want to work for the federal government as a civilian, or you might want to join the public health service. And remember, there's so many government agencies that you may want to work for that you might want to do your research on, because I didn't realize how many government agencies there were. And I didn't realize that I can, as a public health service officer wearing this uniform, I can work for various agencies. I can work for the Bureau of Prisons. I can work for the Indian Health Service. I can work for the Centers for the CDC. I can work for the Food and Drug Administration. I can work for Immigration. I can work for the Centers for Medicare and Medicaid Services. I can work for HRSA, where I'm working now. I can work for civil rights. I can work for the Coast Guard, because the Coast Guard, they don't have their own healthcare team. They use the United States Public Health Service. We could also do details to other branches of the military. Like there's public health service officers that are detailed to the Air Force. They're detailed to the Army. Many psychologists and social workers are providing mental health services to those service members that were off at war, and they come back with certain mental health issues. So some of our public health service officers are providing care for those individuals in the Army or the Navy or the Air Force. So there's lots of opportunities that you can work for various agencies and still wear the uniform, and your benefits and your rank stay with you throughout your career. So even though you're switching agencies, you can maintain your rank and your benefits and things of that nature.
Wow. Yeah, you mentioned that was like at least 10 things.
Yeah, there's more. There's more. There's more besides that.
Yeah. So you need, and most of the time you just need like what's the education requirements is like a bachelor's or
well,
maybe
for nursing,
like a master's nursing?
For nursing, it's a bachelor's degree, the minimum requirement. But for other health professions, it depends on the health profession and what their requirements are. But for nursing, it's a bachelor's degree. In other professions, it might be a master's degree. In other professions, it might be a doctorate. So it depends on the profession. Exactly.
Okay. Yeah, that's good. So in your role right now, do you have what are some of the challenges you face, working data on your day to day, or some of the challenges you face in your role today?
I think just trying to find innovative ways to get the word out about our funding. Do we do an event? Do we do a webinar? How to present the information? Do we do PowerPoint presentation? How to effectively get the word out in terms of pamphlets, how to explain this information to parents that may get, if I'm wearing the uniform. Sometimes I do events where I don't wear the uniform because sometimes I think I'm in the Army or something like that, and I don't want my children joining the military. I'm like, well, this is not, we're a uniform service, but we don't carry weapons, so it's a little bit different, even though we have the same benefits and we do have a rank structure. So, trying to explain that, whole scenarios, that can be a challenge. And just sometimes dealing with the government bureaucracy. I know there's a continuing resolution right now, so some of our events and things that we have planned are on hold right now. So that might be a challenge where we have to get partners and organizations together to do an event, to network, and we have to say, okay, we're experiencing a continuing resolution with the government. They don't have a federal budget at the moment. Congress is still deciding what the budget should be. So we have to put this event on hold. So we have to explain that that's how the government works. So that can be a challenge also.
I believe it. So do you guys utilize any of the new, not really new, but like any social media like Facebook, TikTok, and to get the word out?
The agency uses Twitter, Instagram, Facebook. They do use those platforms. Yes.
Have you found like more success with like the younger audience in engagement at all, or is it more just
I think the younger folks, and even the people of all ages, they have their cell phones available. So sometimes when I'm giving a talk, I'll tell them to get out their cell phone, and because sometimes we have like clinic locators, we can locate a clinic, a community health center that's funded by agency, Health Resources and Service Administration. So I'll ask them to get their phone out, and most people say go to Google. Put in this website, and most folks can do that. Especially the young folks, they're very tech savvy, and that's very useful with their phones and things like that. So yeah, it's very useful.
That's really good. Let's see. I think so. Where do you think what direction is, I guess, DHS moving in? I think when it comes to addressing the need to getting the word out. What are you guys doing that's a little bit different or innovative?
I think we're starting to use webinars more. I think that's ever since COVID came out. The webinars are very big and useful. I'm using different platforms, Twitter. I think it's called X now, but Twitter, Instagram, Facebook, using all those platforms. Using text messaging. Sometimes some of the programs they would use text messaging to remind individuals to take their medication, or reminding mothers to be for their appointments. So using text messaging, using your cell phone more, maybe developing certain apps. Certain apps were developed, throughout the past years. So yes, using technology, I think it's going to be a big thing to help with healthcare and to help to get the word out about various funding programs and various things that are going out with different agencies.
I think this is a great platform too. I know some students are, like I said, like trying to find ways to get involved in the government, and also trying to get ways to lower their student debts that they had mounted from years of study.
Right.
So I think this is also a really great way to get it out. I believe so. I think this is, like I said, once again, a really great platform. I believe I think I'm like all out of all my questions. Do you have any final thoughts or anything you want to, say to the audience about your career, DHHS, honestly, anything?
Well, just if you're interested in healthcare, just pursue it. There's a lot of different avenues to pursue. You don't know where you're going to be going, so you can use your degree that you've earned in many different ways in healthcare, and and look at all your options. There's options at the state level, the county level, the city level, various private institutions and organizations that can provide career opportunities. The federal government can provide career opportunities, so there's a lot of opportunities out there. I've only scratched the surface, and that I know I'm aware of. There's a ton more opportunities. So I just recommend people that look at all your options, and you'll have a good career of opportunities and a variety of things to do and things that you will be doing.
Okay, yeah, thank you so much. I believe so. That is going to be the end for tonight's speaker series. Thank you so much,
You're
Captain
welcome.
Vargas, for showing up and talking about your experiences. This has been really informative for me, and
Great. Thank you.
I think everyone else has really appreciated it as well.
Okay.
Yeah, so thank you, and for everyone else, please once again subscribe. Next month we'll have new speakers, but also thank you for listening, and we will see you again soon.
Thank you very much.
Thank you. I think